It's easy to focus on the big, epidemic, outbreak, pandemic-prone diseases that make headlines. But in Nigeria, the biggest burden is actually the day-to-day infections that kill people, especially children under 5. My name is Niniola Williams, and I lead an organization focused on public health in Nigeria. The organization was founded in 2015, which was a year after we lost my aunt. She was the doctor that identified and contained the first Ebola patient in Nigeria. But in the process of doing so, she lost her life. And so a year afterwards, we decided to start an organization that would work alongside the government to really build resilience in the health sector and improve the state of things to make sure that that kind of thing wouldn't happen again. I think the thing is people focus so much on the formal health sector in Nigeria, trying to strengthen it, and that's important as well. But for us, we know that a lot of these public health emergencies start with people in a community somewhere, often quite rural or remote. And so if you don't have health champions in those places, trusted people who can both serve as connection to the formal health sector, as well as trusted authorities within that community to serve and to guide and to advise on what to do, that's when you now end up with bigger problems. And so for us, it's really bridging the gap of, yes, we want to focus on the formal health sector, but we also want to bring in these other sort of formerly marginalized groups. Nobody's engaging youth on such issues because, they're children, what do they know? But in fact, they're extremely innovative and creative, and they come up with the best solutions. I think changing a system is very hard, right? Whether you're changing a health system or an education system, it's extremely difficult. But for us, I think the lesson we learned from my aunt was that one person leading a small team of people could literally change the course of history. She changed the trajectory of Nigeria's history by containing that virus, even though she sacrificed herself in the process. And so for us as an organization, we focus on investing in individuals. We could focus on the infrastructure and the other bigger things, but we believe that to change a system, you have to change the people in that system. We work from the ground up as well as from the top down. And from the ground up, what that looks like is building a network of health champions across the country who are people that are taking responsibility for their own health, but also influencing the health of those around them and changing the systems that they work in. Day to day in Nigeria, people are dying and suffering from infections that are preventable. And so for us, that's our main focus, actually, not just the pandemic-prone diseases. And so if we can't get that right, we're not even able to quantify the impact of what's going on. And so for us, I think the misconception has been that, we're here for when there's an Ebola or a COVID. But in fact, we're here to strengthen the system and change the system for the daily needs that people have. The vision that we have for Nigeria is a Nigeria where every community is equipped with people who have the information they need, evidence-based truths, to make sound decisions about their personal health and the health of their families. We've seen so many tragic incidences where things have turned out negatively simply because people don't understand, ignorance or lack of trust or lack of access or lack of quality care. And we just really want to see a country where my children and my children's children can have a health system that supports them to be the best citizens they can be, to go forward and change the world in whatever way they may want to.